Hi, my name's Gaby Judah. I'm from the London School of Hygiene and Tropical Medicine. I'm sorry I couldn't join you today in person, but I'm just going to talk you through my presentation, and if you've got any questions at all afterwards, I'd be more than happy if you emailed me. My email address is on the front slide. So I recently finished my PhD looking at some psychological determinants of habit formation, and I'm going to talk today about the role of reward in the habit formation process. So, as a recap, habits develop when behaviours are repeated frequently in a constant setting, so that over time they become to be triggered automatically by that context when those cues are encountered. And the real key feature of habit is a high degree of automaticity when behaviour is being performed. So I may use the term habit and automaticity interchangeably during this presentation. And it's been shown that past behaviour and habits are more predictive of future behaviour than intention. So even if somebody wants to do a new behaviour, such as wash their hands with soap, their past behaviour and habits may override that and mean that when the time comes for them to wash their hands, they don't actually do it. So for that reason, habit is cited as a really key way to achieve sustainable changes in healthy behaviour, as this is what predicts long-term behaviour performance. So we should investigate how habits form if we want our behaviour change efforts to work long-term and to change behaviour in that way. And there hasn't been a great deal of research into how habits form, and what I'm going to talk about today is some findings about the effects of rewards, experience rewards, on the habit formation process. So from animal research, we know that rewards are important in reinforcing behaviour. They make it more likely that the relationship between the contextual cues and the behaviour are strengthened, and so that behaviour proceeds more automatically. And I want to see whether this reinforcement process works in people as well. And the hypothesis here is that habits will form faster if behaviour is found to be more rewarding. And when I say rewards, I don't mean that people are being given money or anything like that to perform the behaviour, but I'm looking at the effects of intrinsic rewards, so how rewarding it feels or enjoyable it feels to actually perform the behaviour itself. And this is useful because if we know how rewards affect behaviour, we can use this to potentially accelerate the habit formation process. And if we know how to make habits form faster, then it's more likely that our behaviour change efforts will be sustained over a longer period of time. So the study investigated flossing behaviour actually in 56 households in and around London, and the households were from the general population, and they have low baseline rates of flossing, dental flossing, so we could see changes in behaviour and habit over time. And the study took place over 16 weeks, and there was clustering of at least 2 people per household. So we had 118 participants in general. Flossing was chosen as a simple behaviour that's performed once daily. But this is something, we think the findings may be applicable across different hygiene and health behaviours in general. So the intervention consisted of a face-to-face session 4 weeks after the start of the study. There was a leaflet which was talked through with the participant by the researcher, by myself, and the leaflet included information about the benefits of flossing and instructions on how to floss and when to floss. There was also a planning component, which is shown to be a good way to change behaviour, where participants thought about their own individual routine and wrote down specifically when and where they would floss, and signed a pledge to try and floss their teeth every evening. So one of the planning, for example, could be when I finish brushing my teeth in the evening, I will floss. Or perhaps when I walk into the bathroom at night, I will floss. So something that says when in particular they are going to floss their teeth. So that was the intervention. The measurements were by questionnaire, by survey, which took place every 4 weeks during the study, and these questionnaires were emailed to the participants. The main measures that we'll be discussing here are behaviour frequency, so how often the behaviour was performed, and that was how many times they flossed their teeth in the past week. Then habit was measured using the self-report behavioural automaticity index, which is a 4-item scale which measures how automatic a behaviour is. And as automaticity is a key component of habit, this was the scale that was used for this study. Reward was measured of how enjoyable or satisfying or pleasurable the behaviour was found to be, and also intention was measured, so how much people felt that they wanted to do the behaviour. Unless indicated otherwise, the questionnaire responses on a 7-point Likert scale from strongly agree to strongly disagree. Just to recap, reward was measured as the experience of performing the behaviour, as opposed to any kind of extrinsic reward that is given to people for performing the behaviour. The analysis was done using structural equation modelling, so we could try and get at some causal components of the habit formation process. And at each point in the study, following the intervention, each point when the questionnaires were answered, the model was calculated separately for those different time points. And we investigated several different pathways from reward to habit, and each of these pathways supports different theories about how reward affects behaviour and habit. So the first pathway was that the effect of reward is mediated by behaviour. So that means there's an arrow from reward to behaviour and behaviour to habit. And this means that reward only affects habit by increasing behaviour repetition. So we know that when behaviour is repeated, habits strengthen, and this means a pathway such as this means that reward works just through increasing behaviour, and then we know that behaviour increases habit. And this is kind of the classic social cognition approach. The other key pathway that we tested was whether reward moderates the behaviour-habit relationship, and this was modelled by including an interaction term between reward and behaviour and looking at the effects of this interaction term on habit. And the meaning of this term is that if we find a positive relationship, then increased reward strengthens the effect of behaviour on habit. So if someone finds the behaviour to be more rewarding, then their behaviour has a greater impact on habit than if they find it to be less rewarding. And this is the classic reinforcement theory, which is talked about in animal learning literature, and we want to see if it applies here for people as well. I also included a direct effect of reward on automaticity, which is not something that's theoretically expected, but it's been observed in previous studies. So due to these empirical observations, we want to include it and to make the model more complete. In terms of the results, we found several different significant pathways at the different time points over the study. We did find the mediated effect of reward on habit, which is saying that reward only has an effect on habit via increasing behaviour. But this was only seen at the point 4 weeks after the intervention. So while we did see some mediated effect, we can see, as there were the other pathways, reward didn't only have an impact on habit via behaviour, because 8 weeks following the intervention, we had a significant moderation effect. So reward was found to increase the impact of behaviour on habit, and this supports the reinforcement approach seen in the animal learning literature. So, and this I will illustrate this in a graph on the next slide. We also, at 4 and 12 weeks following the intervention, saw this unexpected direct effect of reward on automaticity, but which would mean that reward leads to greater habits totally independent of behaviour. As this isn't theoretically supported at all, it may be the case that this could be due to measurement error. So there's either measurement error in the measurement of behaviour, or there may be other factors on the pathway which we are not taking into account. So to illustrate that moderation effect that I mentioned just before, the graph on the right shows the modelled effect of behaviour of flossing frequency in the past week on automaticity, moderated by rewarding experience. And this is the relationship that was observed 8 weeks following the intervention. The red line in the middle shows the modelled effect of a mean level of reward. And the blue line, which is steeper, shows mean reward plus 1 standard deviation, and the green line reward minus 1 standard deviation. So as the blue line is steeper, we can see that flossing frequency has a stronger impact on automaticity for people who find the behaviour to be more rewarding, which means that rewards strengthen the impact of behaviour on automaticity, and the participants who found flossing to be more rewarding and enjoyable showed greater increases in automaticity per behaviour repetition. I'm also going to summarise briefly the effect of intention which we found. So there was some effects of intention on behaviour at 4 and 8 weeks following the intervention. So people who strongly intended to do the behaviour did do the behaviour. However, this effect was not long-lasting. However, at 8 weeks following the intervention, we found that people who more strongly intended to do the behaviour had weaker effects of behaviour on automaticity. So even though they may be more likely to do the behaviour, that behaviour is less likely to be habitual. And this again is a modelled graph based on the final structural equation models. So in conclusion, if someone finds a behaviour to be rewarding and enjoyable, it becomes automatic more rapidly. So rewards are reinforcing of behaviour. The unexpected direct effect of reward on habit, which was independent of behaviour, was likely to be due to measurement error. However, the fact that we saw this direct effect and that we saw the moderation effect suggests that the effects of reward on habit are not just mediated by higher levels of behaviour. So it's not just that if someone finds something to be rewarding, they're more likely to do it, and that increased repetition is more likely to lead to habit. It suggests the reward is having an effect over and above that on automaticity by strengthening habits and making behaviour repetitions more likely to lead to habit. And we found that reward is more important than intention in behaviour change. So this suggests that behaviour change efforts shouldn't be solely focused on intentions that change behaviour and changing people's intentions, and rather we should take into account the experience of performing a behaviour. How pleasurable does it feel to use the soap or to floss or whatever behaviour it is you're trying to change? And we should think about how to make it more rewarding and enjoyable, and to emphasise those rewarding and enjoyable features. And because we found that the experience of performing the behaviour is something that reinforces that behaviour and makes it more likely to be habitual. And if it's a habit, then it's more likely to be sustained over the long term and lead to positive, healthy changes in hygiene behaviour. Thank you very much. I'm afraid I'm not here for questions, but if anyone else on the panel can help, that would be great. But otherwise, please do get in touch with me. My email address is gaby.judah@lshtm.ac.uk.